Dear friends, welcome to the show, Talk with Your Doc. I'm Dr. Prashant Tijani, and our guest for today is Dr. Stewart Holtby. Dr. Stewart Holtby is practicing in Thunder Bay, Ontario since 1987, and he is sleep medicine disorder specialist, in addition being respirologist in Thunder Bay. And he has American board certified degree in sleep medicine, and he has been practicing this in Thunder Bay for quite a long time. He has done various studies, he has published various articles, and he is serving College of Physicians and Surgeons of Ontario Task Force in revising the edition of critical clinical practice parameters and facility standards. So we are very happy to have Dr. Stewart with us. Thank you, Dr. Stewart, for joining us today.
Thank you. Thank you very much for asking. One thing I should clarify right out of the starting gate is that I retired from clinical medicine, clinical sleep medicine 3 years ago. And so my role with the college is in the past, and I'm currently working at the Thunder Bay Regional, not doing sleep medicine, but rather assisting in the operating room. But I have a lot of experience in sleep.
Thank you so much. So sleep is a very essential and vital component of well-being of a human being. Even though everybody has some or other sleep-related issues in their lifetime, please tell us, when does a sleep becomes a significant issue? Like, when is the sleep deprivation, or it becomes a real problem in the life?
Well, I think problems with sleep can occur at any time in the life course. Probably the people are most aware of two disorders in sleep that are very, very prevalent, one being insomnia and the other being sleep apnea. But there is a whole array of sleep disorders. And insomnia can be a problem really at any age, but I would say it's even more prevalent right now worldwide with, as everyone says, these unprecedented times with the pandemic. Sleep apnea has been an increasingly recognized problem. It was first really described hundreds of years ago in Charles Dickens' Pickwick Papers, but it's been recognized particularly in the last 50 years as a major problem.
So sleep is generally common. Sleep deprivation or sleep disturbances are a common phenomenon in everybody's life. So what do you suggest to get a best sleep?
Well, excuse me. For sleep deprivation, probably the commonest thing that you and I would be familiar with is sleep deprivation simply related to workload. That you're up late, up early, and you're having to sleep short hours on a slightly irregular schedule. And many people are familiar with that related to their work, medical or just in the course of everybody's work life. So short sleep hours related to work and other commitments, family commitments. So sleep deprivation, put it this way, 1 hour of sleep lost every night over what you should get over the course of a week makes you significantly impaired. You can function. We're built to function despite being sleep deprived, but you can't catch it up quickly just with a few more hours on the weekend. It's a major problem for people. So
to get best sleep, when too much work, or people who are workaholic, they have an issue with the sleep disorders or insomnia related issues. People develop this sleep disorders when they are not regular in their sleeping habit. Is that correct?
Yeah. Again, I think there's two different sort of areas that we're talking about. One is short sleep hours related to staying up too late, working, studying because of irregular work scheduling, getting up too early for the same factors can shorten the amount of sleep that you're getting and cause progressive impairment. That's in some ways quite different from insomnia, which is, defined as difficulty getting to sleep when you want to, difficulty getting back to sleep during the night, associated with trouble functioning in the day. And that issue, not so much, if you will, a typical surgical resident who is up late studying all the time and up early to do rounds has no difficulty falling asleep and no difficulty falling back asleep. They just struggle to get out of bed when their alarm rings because they haven't slept enough. That's not really a clinical sleep disorder as such, but there are many, many people that have insomnia, that have difficulty getting to sleep, even though the timing and the setting is great and they want to sleep, and often they're tired and having trouble staying awake in the evening. But when they get into bed, they can't fall asleep. And likewise, many people have difficulty, they're okay falling asleep, but they wake up during the night, too early in the morning, and they can't return to sleep. To give you a sense of how prevalent that is, Dr. Jani, last night, about 30% of the people that are watching us discuss this had difficulty sleeping last night, about 1 in 3. And about 10%, 1 in 10, have trouble at least 3 nights a week, at least for 3 months steady, which is the definition of chronic insomnia. And that can go on indefinitely. That can go on for a very long time and create a lot of impairment.
So what can be the reason for those people who are having difficulties falling asleep?
Well, it's complicated. And the way I would typically think about it clinically is there's predisposing factors to insomnia. There are things that then precipitate the onset of insomnia and things that perpetuate the insomnia, that keep people in that pattern. Predisposing factors they're legion. It's often adverse experiences can really predispose people to insomnia. And, something to remember is that, about a third of all women experience sexual assault or abuse in the course of their life. That's a major adverse experience. And the adverse experience through childhood of many things is very, very common in all societies, from the top of society to the most, to the people with the most challenges. Social determinants of health have a strong impact on as a predisposing factor. So, food security, a safe, secure place to live, work and money stability, access to education, healthcare, racialization and gender, how you are labeled and seen in the world, a colonial legacy is very important. Family history, which is a complex thing, not just of some genetics, but also of how you are taught to cope with stress and how you are taught or not taught resilience in life. And that's just predisposition, which is really, very difficult to change in people. Precipitating factors can be major, pandemic, and all the changes that bring, can be a pile of minor things, one on top of the other. The thing that we can really adjust are the factors that perpetuate it, because the normal response if you're having trouble sleeping, what most people, if there's someone with insomnia listening right now, what you probably do is go to bed when you're tired but not sleepy, have trouble, and stay in bed trying harder, which, in a nutshell, is what goes wrong with insomnia.
So you go to bed when you are sleepy. Don't go to bed when you are not feeling sleepy. Is that?
Yeah, yes, absolutely, sir. And I think, if you might say the rules are, the pattern, the sort of 10 commandments, if you will, are first, set the stage, prepare for tomorrow, put the day away, put the world away, put your worries to one side. And there's a number of very good strategies to do that. 2, make sure that you have a quiet, comfortable place to sleep. 3, wind down. So again, you've put the world away. Now do something relaxing and distracting before bed. So a good relaxation distraction routine. And one of the best, single best, is a story. Reading a story, listening to a story, watching an old familiar story. And then number 5 there would be to keep the relaxation, or sorry, 4 is wait until you are relaxed before you get into bed. Don't get into bed going, look at the time, I have to get up in 7 hours. I have to go to bed and sleep now, and climb into bed expecting to fall asleep, because you won't. Don't get into bed until you're relaxed and ready for sleep. Keep the relaxation routine going when you do get into bed. And if you have trouble falling asleep, don't stay in bed trying harder, getting frustrated, watching the time, then spinning and thinking about all the things that will go wrong because you're not sleeping. Get up at a consistent time every day, every day. That's way more important than going to bed at a consistent time. Go to bed when you're sleepy, but get up at a fairly consistent time all the time if you have trouble. Avoid naps. That's, we could talk for half an hour on just about napping, but avoiding naps, minimizing caffeine, minimizing alcohol, getting regular exercise. And those are really the main 10 points. And there are many, many guides to this that are extremely useful and very well written. From Toronto Health Network has a very good set of guides. People can access this online easily. Toronto Health Network, CAMH, Health Canada, Canadian Sleep Society, the American CDC. If you just type in any of those sites, sources, and insomnia, you'll find very well written, well illustrated guides to all this. A consistent wake-up time is more important than a consistent bedtime, particularly if you're not sleepy when you're getting into bed. The wrong thing that people have this idea, I have to get up in the morning, therefore I need 8 hours, which isn't always, which isn't true per se. If I'm getting up at 7, so I have to be in bed at 11, and if I don't go to bed at 11, the world will end. I'm not sleepy, and they're not sleepy at 11, and when they get into bed, they lie there, how do people feel when they lie in bed awake? How do you think they feel? What do you think?
Yeah, they feel frustrated, They don't know what to do now.
They feel frustrated.
Yeah.
And what does that do to their sleep? It makes them sleep poorly, which makes them frustrated, which makes them sleep poorly, makes them frustrated, makes them sleep poorly. And that is exactly why there are many people are drowsy when they're sitting in, they're reading some papers, they're watching television, relaxed, they're falling asleep, they get into bed, they're wide awake. Why? Because their brain looks around and says, this is the place that we're frustrated. They teach themselves that bed is a bad place. What do? Then they stay in bed. So again, the things not to do. Stay in bed and try harder. Not a good idea. That just drives this cycle. It just keeps it going and going and going. Look at the time. It's either too early or too late. It's never a good thing. Looking at the time, if you're sleepy, it doesn't help you go back to sleep. And most of the time you look at it and go, I've only slept, or I haven't slept, or look how little time, or look how much time. It doesn't help at all. Looking at the time is a very bad strategy.
Now, please guide us. How much sleep is required? Minimum sleep is required, or healthy sleep time?
So how much sleep should you get? Well, you should get what your body needs, which is typically about 8 hours through the night. Most of us don't do that. And it's really important, though, if you're having difficulty sleeping, the absolutely wrong thing to do is to take that information and, as I said before, think, it's 11 o'clock. I have to get up at 7 o'clock. I have to get to sleep, because if I don't, I'm going to be sleep deprived and the world will end. And get into bed and lie there trying to sleep and failing. And then you'll sleep even less and you'll feel even worse. So if you're having difficulty with insomnia, focusing on what a healthy, normal sleeper might get is a road to ruin. You know, put the world away, have a good relaxation distraction routine. Don't get into bed until you're sleepy. Don't stay in bed if you're not sleepy. When you wake up, or if you're having any difficulty, go back to your relaxation routine. If it's not working, get out of bed until you are sleepy. Get up at a consistent time, all the time, including weekends. Don't try and catch up all the hours you think you're missing on the weekend. Avoid caffeine, avoid alcohol, get adequate exercise. That will help you.
That's very helpful. One question is it true that as you get older, you do get less sleep or you need less sleep?
Nope. No, it's not. There are a number of changes, you know, with age, absolutely. One is that you remember I said that it's normal for people to wake up once or twice during the night. That's the only people where that would not be normal would be someone who's like 14 or 15 years old, like in sort of early to mid-teens. They are the best sleep, you know, the 12-year-olds are champion sleepers. They sleep straight through. But from people's 20s, 30s on, especially when you get to be a fossil my age, people start to wake up more during the night. That's a normal physiologic aging change. And you may be awake for, you know, half an hour, an hour, but that's not that unusual, especially into your 70s and 80s. The timing of your sleep tends to become a little bit earlier. So older people tend to get drowsier earlier in the evening and wake up earlier. That's normal. But if you look at the total sleep that they require, it's about the same. It's about 7 to 8.5 hours.
That's good. Are there any other products available or pharmaceutical agents available in the market you can buy to get a better sleep?
The crucial word in that sentence is better. You know, no. Not really. Improving sleep habits and sleep behaviors is much more important than anything else. Prescription or especially over-the-counter medications are not a very good strategy. They do work in the short run. So, you know, if someone is having acute difficulty falling asleep, a short-acting sedative like Zopiclone, just as one example, or Zaloplan, Indaplan, medications like that can help people fall asleep initially, but they are absolutely no substitute for addressing the habits that may perpetuate sleep. And if you look at you know, how long it takes someone to fall asleep and how much sleep they get overnight on a medication, and then look at, you know, it improves quickly with the medication, yes, but it also improves relatively quickly with behavioral and thinking changes, you know, specific therapies to improving your habits. That improves your sleep typically within a week, as opposed to within a night. If you then look a month later, the medication and the behavioral and cognitive thinking changes are about the same. If you look 3 months later, the medication is failing. And then it's really hard to get off of it. And it can create major daytime problems with hangover effects, especially if you're using, and the behavioral changes are very durable. They're very long lasting. They really help. The problem with over-the-counter stuff is, you know, if you're taking, you know, people think because it's got PM or, you know, safe or whatever written on the package that it's harmless. It's not harmless. And all of the stuff that's available over the counter, at least in this part of the world, typically has either Gravol or Benadryl in it, to use two trade names, you know, dimenhydrinate or diphenhydramine. Gravol and Benadryl are the long-acting antihistamines that can impair you during the day. So don't use those. I really recommend against using those. And, you know, are there other gadgets? You know, other things? Alcohol, not so good. Drugs, THC and equivalent, also not so wonderful, especially if you're not addressing all the other behavioral things. Lying in bed, trying harder to sleep, watching the clock spinning, and catastrophizing about the next day, those bad habits. Mattresses, white noise generators, getting heavy blankets, light blankets, heat, cool, whatever. They have some, if you're uncomfortable in some way, changing that can help. But again, you want a quiet, comfortable, slightly cool environment where you're not disturbed and where your mind is not disturbed by avoiding, setting the stage, putting the day away, getting a good relaxation routine that you can sort of walk from the couch in the living room to lying in bed doing it, to thinking about it as you're falling asleep, and going back to that if you're having trouble falling asleep. That's a better overall strategy for this.
That's a lot of info. Thank you so much for giving that much information. Really appreciate that.
I talk too much, I know.
Has a sleep disorder, they undergo sleep study. So what is this sleep study all about? Can you please explain us a little bit?
Sure. Sleep studies are not typically used for, we've been mostly talking about insomnia, and sleep studies are generally not used to investigate someone who has insomnia. There's a few very specific exceptions to that, but sleep studies are generally used when someone is suspicious that you have sleep apnea. It's probably the commonest indication. There's a few other things that people are looking at, restless legs, REM sleep behavior disorder, sleepwalking, but the lion's share, the overwhelming majority of patients that I studied in the lab that I ordered, studied in the lab that I ran, were for suspecting sleep apnea. A good sleep lab has a quiet, comfortable, private space with very well-trained staff who are very good at smoothly putting you through all this gear on, which takes about 20 minutes or so. A good lab does studies that are appropriate to the person's actual problems, takes into account all the person's sleep issues, not just sleep apnea, and helps people find the right therapy. So, it can be very, very useful information. It can be very misleading information if you just look at one parameter and say, if someone is studied and because they snore and someone's suspecting that they have sleep apnea, and they come up with an index saying you have 10 breathing events per hour, so you have to treat that. If they have no symptoms, that doesn't always make sense. And that's one of the biggest problems, if you will, in sleep medicine these days is places that aren't matching the investigation to the patient's problems.
Now, one last question is about the sleep apnea. Can sleep apnea be dangerous, or should we worry about it? What do we do about it?
Complex topic. Is it dangerous? Yes, it absolutely can be. It's common, very common disorder. And we know that sleep apnea is, other than sleep deprivation, sleep restriction related to work and shift work, sleep apnea is a leading cause of abnormal drowsiness, and that increases the risk of serious accidents. And that is probably one of the single biggest dangers. Sleep apnea can worsen high blood pressure. It can worsen or predispose you to cardiac dysrhythmias, atrial fibrillation in particular. It can worsen the control of your blood sugar if you've got diabetes. And it's associated with an increased risk of heart attack and stroke, although and also associated with an increased risk in pregnancy of eclampsia and preeclampsia. But with those disorders, it's a little bit unclear if treatment, even early treatment, is clearly preventative for those things. There's a lot of contradictory information about that. Absolutely no question that treating sleep apnea lowers drowsiness. That is the single biggest benefit. And it also controls the snoring, which helps your partner's sleep. It can help control hypertension, help improve control of blood sugar. Absolutely, it does those things. Other effects are less clear right now.
So healthy sleeping habits will help us to overcome the sleep apnea, or is there anything else?
No, no. Healthy sleeping habits, no, not really. If you have sleep apnea, you know, if when I saw someone with sleep apnea, what could I suggest? Well, if someone was only sleeping 5 hours a night because of the work they were doing, they were getting, you know, going to bed late, getting up really early, you know, increasing their sleep hours, yes, that aspect of sleep habits would help someone's obstructive sleep apnea. But for most people, that wasn't enough, especially people that were at a level where they were being referred, you know, to me at a sleep center. What could they do? Weight loss helps. That's not easy to accomplish. But decreasing alcohol and smoking helps. Sometimes if someone's apnea is clearly worse on their back than on their sides, there are positioning aids you can use that keep people on their side at night. That would help. In a few adults, but a lot of kids, tonsillectomy or taking tonsils and adenoids out would often help. Many people, the main therapy they needed was to put positive airway pressure, you know, to change the mechanism of breathing slightly, to pressurize their upper airway during sleep, to hold the airway open. That's what continuous positive airway pressure therapy is, CPAP. And, you know, there's auto-adjusting positive airway pressure, APAP, bilevel positive airway pressure, BiPAP. But the positive airway pressures are the mainstay of that. There's a few other things that are used, like dental devices that can pull your jaw forward to open the space at the back of your throat. Expensive, have a checkered success rate. You need to find a dentist that's very interested in it to work that through with you. Jaw and tongue surgery and surgery on the palate, again, people have tried those in the past, including locally here in Ontario and Thunder Bay, but it's not very successful. And there's no current drug therapy. So if you said, what are the two biggest things that can improve obstructive sleep apnea? Weight loss and positive airway pressure therapies.
Thank you, Dr. Stewart, for such a wonderful session today. We got a lot of information from you, and we are thankful for your time.
Well, thank you very much. Thank you for the interest. And as I'm sure is evident to you and anyone listening, you know, sleep and sleep disorders are a complex topic. So there's a lot of ground to cover, and I'm hopeful that people will seek further resources. And as I said, there are a lot of excellent resources these days out there on the web.